of that, we have so many different locations and practice types that they get to experience throughout their training. So they work here in a very academic setting, but they also go to a lot of other rotations where they work with private practice physicians. They go to a rural location and an international location. And so the training we're able to provide is very broad.
This program's different than I feel like a lot of other programs. You go out and you interview at places where they only stay at one hospital for all 5 years. So all you get is the experience of that one hospital.
Here at the U of A, we really cross-train in a very broad variety of practice settings. We serve low-income and low-resource communities at our South Campus location. We work in private practice at TMC. We spend time working within the VA healthcare system here. We spend time serving the reservation up at our site at Tuba City. We have kind of a mix of private practice and low income up at Flagstaff. We do a lot of trauma. We do a lot of the high complexity stuff with our surgical oncology, HPB rotations.
Our residents also train at Groote Hospital in Cape Town, South Africa. At PGY4 residents spend at least 8 to 10 weeks at Groote Hospital.
Here, so you work at essentially every different kind of hospital. We have the VA experience, we have county, we have a private hospital, we have the academic hospital, as well as our away rotations as well. I think we do a good job giving you everything you need in one program.
And so we really get exposed to the full gamut of diverse locations as well as practices.
It's really nice to have the opportunity to get exposed to many different rotations and different types of surgeons. It's just different in what kind of surgeries you do, the patient population.
Then the University of Arizona here was a very academic place, very complex patients. It's a referral center, it has a level 1 trauma center, it serves around 90 miles around, which is really good exposure for my training.
And then we go to a community hospital called Tucson Medical Center, kind of a general surgery rotation, and we do some vascular surgery there as well.
So over at TMC, we do the private hospital and get to see what that sort of career path would look like.
When I was an intern, I started at the VA, which is, older patients, World War II vets, Vietnam vets more so, have COPD and other things like that. So it just increases your challenge, but also makes you really appreciate how successful you can be. Those people are strong.
We also have a really cool South Campus experience, which is the county patient population, which when I work there, I really kind of get that experience.
It involves a lot of patients of lower socioeconomic status, so it's a lot of the uninsured population that has a fair amount of comorbidities and tend to be more sick and have.
Tuba City is in the heart of Navajo Nation, and so we serve the Native American population there, and so that's a great change from some of the university patients we get here.
But that was also the first time that I was alone with 5 different attendings. We would do the scopes in the mornings and then whatever came into the EDs, and I think that really solidified the feel of Tuba City.
You get a little bit of an experience being a chief of your own service and starting to explore a little bit more of being a more senior resident when you're really just a PGY2 still. So I think that aspect of our residency is truly great.
It's, I would say, an experience that it would be hard to get anywhere else. And you go there and you do general surgery, and and we do a lot of endoscopies over there because that's a need that the reservation has that we fulfill.
We get a lot of our endoscopies there, so like colonoscopies, EGDs done there, as well as some general surgery procedures.
But everyone loves Flagstaff. It's really where you find your niche and start operating with confidence.
I think in Flagstaff we have a bigger sense of responsibility, so it's a little different from being a junior resident at some of the other sites. We're expected to drive the operations a little bit more. It's kind of a cool experience, taking more of the surgeon junior role.
And that's a really nice one for us as well. It's a nice place to be, and we do a lot of general surgery and trauma surgery there.
Also, we have an international rotation, which is really looking forward to. We go around 2 months to South Africa, Cape Town. That's really also amazing. You get lots of autonomy there, and you gain lots of experience.
This was a program that was actually set up by Dr. Fonsam, a program director. He put a lot of time and effort in doing this, and so we actually go there for free. Our flights are paid, our housing is paid, and we go there to learn to operate, and we get the level of autonomy that I think we don't get necessarily maybe here in the U.S. anymore. But again, a phenomenal educational opportunity.
One of the main goals was to improve residents' supervised autonomy. The residents are also exposed to a different culture in a third world country, and that gives them a unique appreciation of how they treat those patients and also treat patients in the United States.
And all of these care experiences have really different patient populations and give our residents the agility to be able to practice in any kind of setting they want, with the cultural competency to be able to interact with various diverse populations.